Heroin and Pregnancy video created by Dr. O. Institute for Alcohol and Drug Psychoeducation. Heroin use during pregnancy carries significant risks for both the pregnant person and the developing baby. Here's a breakdown of the potential complications and important considerations. Risks to the baby. Neonatal abstinence syndrome, NAS. This is a primary concern. The baby becomes dependent on heroin in the womb and experiences withdrawal symptoms after birth. These symptoms can include excessive crying and irritability, tremors and increased muscle tone, sleep problems, poor feeding and sucking, vomiting and diarrhea, seizures, more likely with methadone exposure, rapid breathing, fever, stuffy nose and sneezing, slow weight gain, blotchy skin, in severe cases, death. Symptoms can appear within 1 to 3 days after birth but may take up to a week. Babies with NAS often require hospitalization for monitoring and treatment, which may involve medication like morphine that is gradually tapered off. Preterm birth. Heroin use increases the likelihood of the baby being born too early, before 37 weeks of pregnancy. Low birth weight. Babies born to mothers who use heroin are often smaller than expected. Placental abruption. This is a serious condition where the placenta separates from the uterus wall before birth, leading to heavy bleeding and potential danger for both mother and baby. Stillbirth. The risk of the baby dying in the womb after 20 weeks of pregnancy is increased. Sudden infant death syndrome, SIDS. There's an association between heroin use during pregnancy and a higher risk of SIDS. Birth defects. While studies on heroin alone don't consistently show an increased risk of major structural malformations, heroin is often used with other substances that could contribute to birth defects. Neurodevelopmental issues. Some research suggests potential long-term problems with learning and behavior in children exposed to opioids like heroin in the womb, although it's difficult to isolate the effects of heroin from other factors. Smaller head circumference and brain volume. One small study indicated this possibility in infants exposed to heroin. Risks to the pregnant person. Addiction. Heroin is highly addictive, making it difficult to stop using without help. Poor nutrition and health. Heroin use can lead to neglect of one's health, affecting nutrition and overall well-being during pregnancy. Infections. Sharing needles for injection increases the risk of infections like HIV and hepatitis C, which can be transmitted to the baby. Placental abruption. As mentioned above, this is also a risk for the mother. Preterm labor. Heroin withdrawal can trigger preterm labor. Spontaneous abortion. Acute heroin withdrawal has been linked to miscarriage. Respiratory depression. Using heroin close to delivery can cause breathing problems in the newborn. Important considerations. Do not stop using heroin suddenly, cold turkey, if you are pregnant. This can cause severe withdrawal symptoms that can be dangerous for the baby, potentially leading to death. Seek immediate medical help. Talk to a healthcare provider, midwife, or a drug treatment center as soon as possible. They can provide guidance and support for safe treatment during pregnancy. Treatment options. Medication-assisted treatment, MAT, with medications like methadone or buprenorphine is the recommended approach for managing opioid use disorder during pregnancy. These medications help reduce cravings and withdrawal symptoms without the harmful effects of continued heroin use. Methadone and buprenorphine. These are considered safe for use during pregnancy and breastfeeding. They can improve outcomes for both the pregnant person and the baby by increasing prenatal care and reducing the risk of overdose and death. Thank you. Source: Gemini AI.